All attendees are in listen-only mode.
Good afternoon and welcome to the County Health Rankings and Roadmaps webinar on breaking down the rankings model, focus in on sexual activity and teen births. This is the second webinar in the Breaking Down the Rankings Model series, and I'm delighted to have Nicole Agresano here from the United Way of Greater Milwaukee joining us to talk about some of the initiatives that Milwaukee has taken to reduce the rate of teen births. My name is Angela Russell, and I am presenting to you live this afternoon from the University of Wisconsin located in Madison. And again, I am joined by Nicole. And the other thing that I will want you to know is that although you'll be hearing my voice and Nicole's voice on the webinar today, we're also joined by Karen Odegaard, one of the rankings community coaches, and she will be helping us with QA and quality assurance and questions and answers. So I am going to go ahead and get started. The first thing that I'm going to talk to you about briefly is for those who are new to the GoToWebinar attendee interface. So we use GoToWebinar as our webinar vendor of choice, and on the left-hand side you'll see the viewer window. On the right-hand side, you will see the control panel. And because of the number of folks that we have registered for this webinar, we've got over 200 people registered for the webinar today. Because we have such a large number, we're going to use the question log for answering questions. So if any point during the webinar you have a question, go ahead and enter it into the question log in your control panel right around in here, and we will respond to your question. We will also have some time at the end of the webinar, about 10 or 15 minutes or so, to have a Q&A session with myself and Nicole. If we don't get to your question during the course of the webinar, we will be sure to follow up with you. So again, because of the number of folks that we have on the call today, we are going to be taking questions via the question log. So here's what we're going to talk about today. I'm going to provide a brief overview of the County Health Rankings and Roadmaps program. I'll talk about sexual activity and why it's ranked, and then we're going to go into teen pregnancy and teen birth prevention. That's where Nicole is going to take the lead and talk about what the United Way of Greater Milwaukee is doing. I'll wrap it up, and then we'll have some time for discussion and Q&A. First, let me talk to you a little bit about the County Health Rankings. The County Health Rankings and Roadmaps program is a collaborative program between the University of Wisconsin Population Health Institute, which is where I'm located, and the Robert Wood Johnson Foundation. And the overall intent of the County Health Rankings and Roadmaps program is to help create a healthier nation county by county. So what we want is to have improved health outcomes throughout the nation. So what we do is, with the County Health Rankings, we use population-based data, develop those into the County Health Rankings, which then garners media attention and the attention of community leaders such as yourselves, and then that in turn, we hope, catalyzes action and broad community-based engagement. Folks will begin to identify evidence-informed health policies and programs, and then in turn, over time, that we hope that communities have improved health outcomes. This is our overall logic model of where we are trying to get to, improved health outcomes. And I'm just going to pause right here just to do a quick little side note about the County Health Rankings. Recently, I think it was last week, we were featured in U.S. News and World Report highlighting the 50th healthy counties in the nation for children. And one of those measures that was used for the rankings of the 50th healthiest counties was the teen birth rate. So if you have a chance, if you want to go out and look at that information, you can find that in that article on U.S. News website. Again, the whole point of what we're trying to do is to improve health outcomes throughout the nation. So with the county health rankings, nearly every county across the country receives two rankings. The first ranking is the health outcomes ranking, which we consider to be a picture of today's health. The second ranking is the health factors ranking, and that's everything that contributes to the future health of a community. And it's important to note that the rankings that we release annually in the county health rankings are within state rankings. So for Wisconsin, as an example, we rank the healthiest county in the state, not the least, and the least healthy county. We're not doing the healthiest county in the nation, across all counties for everything. We're doing within state rankings for the county health rankings. And so this is our overall model for the County Health Rankings and Roadmaps program. Policies and programs, and a quick example would be the policies and programs that Nicole is going to talk about, influence health factors such as sexual activity, which over time influences health outcomes. If you'll recall, the health outcomes and the health factors are the two factors that nearly every county across the nation receives. So the health factors ranking, what contributes to that are things such as tobacco use, diet and exercise, alcohol use, and sexual activity. We also look at access to and quality of health care, in addition to social and economic factors such as education, employment, income and community safety, and the physical environment. Those are the things that contribute to the future health of a community. The health outcomes ranking is a picture of today's health. And with health outcomes, we look at mortality and morbidity. So we look at premature death specifically for mortality and the overall health-related quality of life for people in each county. So the rankings is one key component of the County Health Rankings and Roadmaps program. The other key component is the County Health Roadmaps part of the program. And so this is the fourth year. We're in our fourth year of having released the rankings. We just released the fourth annual rankings in March. And for the first 2 years after the release of the rankings, folks were delighted to have their data. But the question always came up, now what do? We've got this data. We know where we stand relative to other communities in our state, and we're ready to take action. What can you do for us? And that's when the idea began of we need to have information, tools, and resources that communities can use to take action. And that was the genesis of the County Health Roadmaps part of our program. So there are 4 key components of the County Health Roadmaps. There's our Action Center, there's the Roadmaps to Health Community Grants, the Robert Wood Johnson Foundation Roadmaps to Health Prize, and the work that we have with partner organizations. In our Action Center, I'm just going to go back for just a second, our Action Center has 3 primary components. Number 1, we have our online training and information system for our Action Center. So if you go to countyhealthrankings.org and click on Roadmaps, you'll find many tools and resources to help your community take action. So you can learn more about the rankings data. You can learn how to prioritize, learn tips on communicating your information, and a lot of different things that you can do to help your communities take the next step. That's the first component of the Action Center. A second component of our Action Center is that we have 3 community coaches here on staff at the Population Health Institute that are here and ready to help communities take the next step. So they provide coaching and technical assistance via phone, email, and in certain cases, on-site technical assistance. They're great, and if you're interested in connecting with our community coaches, please let me know and we will connect you. The last component of the Action Center is the What Works for Health. What Works for Health is a evidence database on our website where you can go and look using our model. You can click on tobacco use and find information on programs and policies that are being used to address tobacco use. In addition to finding programs and policies that are being used, you can find out the evidence behind those programs and policies. So if you wanted to know the effectiveness of a clean indoor air program, just as an example, you go to What Works for Health and they will be able to tell you if that type of program or policy is scientifically supported, if there's some evidence, if it's only an expert opinion, or if there's insufficient evidence to say that this is an effective policy or program. So that's another great resource that's out there for folks to use. And that's another key component of the Action Center. Another key component of the County Health Roadmaps project is the Robert Wood Johnson Foundation Roadmaps to Health Prize. Our inaugural prize winners were announced earlier this year, and I'd encourage you to go and visit this website to learn more about what these communities are doing to improve the health of their residents. they're doing great things that really do focus in on the social and economic factors that influence health. And we've already had our call for a second round of applications, and those applications are already in the review process. Again, I'd encourage you to take a look at what each one of these communities are doing. Each one is unique, but their videos are inspirational, and they can give you ideas on what may work in your community or give you some ideas on what you can do to take the next step. Another key component of our County Health Roadmaps part of the program is our national partner organizations. So the County Health Rankings and Roadmaps program currently partners with 3 national organizations: United Way Worldwide, the National Business Coalition on Health, and the National Association of Counties. Each one of these organizations has a shared commitment to improving health and in infusing this message of where we live, learn, work, and play matters to our health throughout their membership. And we're hearing from one of the local United Way partners today. Each one of these partners has a network of local members and affiliates, and they each have a system of providing support and coaching to local members and affiliates for improving health locally. And each one of these organizations has been great to work with. So I gave you a very brief overview of the Rankings and Roadmaps program, talked a little bit about the rankings, talked about the roadmaps and the resources that are there to help you take action. So let's go a little bit into sexual activity. If you recall, here's our quick model of that's the foundation of our program. Again, we think that policies and programs influence health factors which influence health outcomes. Health factors are those key elements of things that influence the future health of a community. Sexual activity is a component of the health behaviors measure. And sexual activity, we look at 2 things. We look at the teen birth rate, which is weighted at 5% or 2.5% of the overall sexual activity measure. And we also look at sexually transmitted infections. And to be more precise, we actually use chlamydia as a proxy for STIs. Today, what we're looking at and delving a little bit deeper into is the teen birth rate. And so we're not saying that STIs aren't important. We know that they are, but we also know that teen births is a really big topic that a lot of communities are struggling with, and quite frankly, these 2 measures go hand in hand. And our information for the teen birth rate comes from the National Center for Health Statistics. So here's on this slide, I have a definition of what we specifically look at, information on the total in 2011 for the nation, and why we look at teen pregnancy and teen births in our actual rankings. So the actual definition and the measure that we use for the rankings for the teen birth rate is the number of births per 1,000 female population aged 15 to 19. In 2011, there was just over 300,000 babies that were born to women in this age group, and we know that teen pregnancy is associated with poor prenatal care and poor preterm delivery, often associated with having low birth weight babies. And we also know that pregnant teens are more likely than older women to receive late or no prenatal care, have hypertension, anemia, and have poor maternal weight gain, which is also associated with low birth weight. In addition, there's also teen births. It makes it, having a kid when you're a teen, having a baby when you're a teen, makes it harder for you to complete and pursue those other educational opportunities that we know will help women to achieve greater success in the future. So I did want to point out, and this information is from the Centers for Disease Control and Prevention, that there's some good stuff going on around the nation regarding teen births. This slide shows that overall, in nearly across every race, in general, the rate of teen births is declining, which is good news. But even though we know that it's declining, we still know that we have a lot of work to do, and that's why Nicole has joined us today. And then this is a quick slide. I'm going to show this very briefly. County by county, the teen birth rate for nearly every county across the U.S. And the lighter counties are where counties that have a lower teen birth rate, and then the darker counties are the higher teen birth rate. And so this is in quartiles. We've got high teen birth rates right around here and lower here and here. But if I were able to blow this up, you'd be able to see that Milwaukee County, where Nicole is from, is a little bit darker. So this kind of gives you a picture of the national landscape of teen births. So right now, Nicole is going to be joining us, and before she gets into the depth of her presentation, I just want to do a brief intro of Nicole. Nicole is a Vice President of Community Impact for the United Way of Greater Milwaukee. She oversees more than 160 United Way funded health and human service programs, as well as leading United Way's community-wide teen pregnancy prevention efforts aimed at reducing Milwaukee's rate of births to teens by 46% by 2015. Public health officials credit Agresano and the United Way's teen pregnancy prevention efforts for a 30-year low in Milwaukee's teen birth rate, dropping from 55 per 1,000 in 2006 to 44 per 1,000 in 2009. In 2010, the rate dropped again to 35.7 and then again in 2011. Nicole's focus has been on the challenges and issues that young people face. Prior to joining United Way in 2007, she spent 6 years managing research in Madison related to reducing risky behaviors by youth and was previously part of Youth Violence Prevention Initiative in Washington, D.C. We are so glad to have Nicole with us today. And Nicole, are you ready to go?
I am, thank you.
All righty, here you go.
Well, hello, and thank you all so much for taking time out of what I know are very busy days to be here with us. Again, my name is Nicole. I'm so proud to be talking about our work here in Milwaukee, and a special hello to my fellow United Way folks out there, as well as the many, many Tar Heels that appear to be on the call. I did get my Master's of Public Health at the University of North Carolina, Chapel Hill, and everything that I know about this really started there, so I'm really happy to be with you today. So at United Way of Greater Milwaukee, we have been in business for a long time, about 105 years in fact, and our mission has always been to solve health and human service challenges in the community. But recently, we've really had an almost laser-like focus on focusing on healthy birth outcomes. Our Healthy Birth Outcomes Initiative, and this is an initiative that's specific to our community as United Way, this is not a national initiative. You can see the goals in front of you. We want young people to delay parenthood until they're adults and when they're financially, socially, and physically ready to become parents, or as those of us who are parents on the phone know, as ready as you ever can be, otherwise none of us would ever have children. We want adults in our community to actively choose and plan to become parents. We want all parents to receive excellent pre, inter, and post-conception and postnatal care, and we want all of our babies born ready to thrive. So we have two core strategies within that initiative, and that's teen pregnancy prevention, which I'm going to talk with you about today, as well as infant mortality reduction. So today I'd like to just give you sort of a macro level overview of the strategy of our initiative in Milwaukee, and then talk specifically about some of the core strategies that have helped our community have success. And one of the things I always like to say when I start talking about this is that this is a intervention or a strategy, an initiative that's worked in Milwaukee. I do not suggest that everything I'm going to share with you today is replicable across all of your communities, but I do think there are some core strategies and some core lessons here that will help all of you both avoid some of the stumbling blocks that we've had, as well as adapt and adopt some of the successful strategies that we've used. So why are we talking about teen pregnancy at all? I think my friends from the county health rankings set it up so well, which is that teen pregnancy is a significant health concern. And while I know many of us on the phone realize that this may be a matter of social and economic justice, there are also some very specific and perhaps less political reasons to think about or to focus on this issue. And one of those is the economic cost of teen pregnancy. When we've been asked how we've managed to get business leaders and perhaps some some not usual suspects on board with this, we've spent a lot of time educating the community about the costs associated with teen pregnancy. And the reality is that most babies born to teens are ultimately paid for by tax dollars. The social costs are enormous. We know that young children born or babies born to teens are more likely to be incarcerated both as youth and adults. We know that they're less likely to graduate from high school, and perhaps most alarmingly, they're more likely to become teen parents themselves and therefore perpetuating a multi-generational cycle of poverty. And we want to talk to, and I'm going to talk about this a little bit more, but the link between sexual victimization and teen pregnancy. In our community, we've done a lot of work to help educate the public about what teen pregnancy looks like, because for a long time, the perception has been that this is just the outcome of irresponsible young people doing irresponsible things, when we know in our community that most babies born to teen girls are fathered by adult men. And in many of those cases, there's as much as a 6 or older year age difference. And we need to talk about that. We need to talk about how our community became complacent in allowing adult men to get teenage girls pregnant. I think that you all understand the close link between poverty. And I just want to mention briefly before moving on the issue of disparities. This is an issue that affects, across the board, that affects young people in our country, but it is especially impactful on our Latina and African American girls. Now, while we're seeing some great results, particularly in Latina rates, still disproportionately, and in Milwaukee in particular, the disparity between white rates and the rates of girls of color are significant and particularly alarming. So in 2008, we set a pretty aggressive public goal, and aggressive is the word I use on the slide. There were some other words used to describe it when we first announced this, because it's really, no one has put quite this kind of a stake in the ground before. We said that if we did everything we thought we could do, if we really looked at the resources, if we aligned them, if we focused on evidence-based practices and on science, that we could reduce birth to teens 15 to 17 years old by 46% in 2015. And today I want to talk to you about how we're going to achieve those goals. So we have a number of strategies, and my husband's a researcher, and he cringes a little bit because when people ask me, how do I know which strategy is doing what, I can't really answer that. And so on behalf of my professors at UNC and those of you listening, I apologize for what may seem to be a little bit of a shaky research design. But I do posit also that what we're doing is working, even if I can't sort of pull out individual tactics and tell you which one is doing what. I would suggest that these tactics used in combination in a way that has been well monitored and has been supported throughout the community is why we're having success. So the next slide will show you one of our favorite things in public health, the logic model, which gives you an idea of this sort of all hands on deck approach we're taking in Milwaukee. You'll see here we have many strategies addressing many audiences with many different activities, but there's only one goal, and that's to reduce birth to teens, 15 to 17-year-olds, by 46% by 2015. And that focus on that one goal and allowing a number of different pathways and different audiences to experience reaching that goal in a way that's more comfortable or culturally aligned to them is the reason we're having success today. So I'm not going to have time to talk to you about all the strategies that we do. I have pulled out 6 of what I think are some of the more interesting and perhaps more replicable opportunities for communities to impact their own teen birth rates. And the first one I want to talk to you about is the Teen Pregnancy Prevention Collaborative Fund. The Collaborative Fund started because we realized that at United Way, although we have a successful campaign every year and we have a wonderfully generous community that allows us to do the work we do, we cannot do this by ourselves. It was imperative that we bring in other funders and other foundations to sit with us to address this issue and ultimately to fund it. So we have 6 funders initially got on board. And every single one of the funders, which is now 9, puts in $50,000 a year that we invest separate from any one board of directors or any one organization. This has allowed us to do a couple of things. Those of you at United Way understand that there are certain organizations or strategies that are difficult for individual United Ways to move on, whether there's a history in the community of distrust or there's some political lightning rods. This fund allows us to invest more aggressively and maybe perhaps more boldly in some strategies that we couldn't probably sell at our local United Way level. So on the next slide, you'll see some of the examples of grants that as a group, the 9 of us have funded over the last 4 years. We've funded grants that impact the LGBTQ community. We've worked specifically with Muslim young women who are Somali and of the Bantu faith. We have worked extensively with youth outreach workers, with promotoras. We've been able to fund Planned Parenthood and some very aggressive strategies around access to contraception, among other things. So this fund is a great example of what can happen when funders work together, and it's a fairly unique model in that in many communities, it's not that funders have acrimonious relationships, but they don't often partner together in such a way, and we've had a wonderful opportunity to learn from each other and to invest in funds that individually we would not have been able to do. The second strategy I want to talk to you about that I mentioned earlier, the issue of sexual violence and victimization. When we did our initial research on this project in 2006, we found some alarming things out about the situation in Milwaukee, which was, as I mentioned earlier, the fact that most babies born to teens are fathered by adult males. Now, to be fair, when I make that broad statement, that also includes 18-year-old boys and 17-year-old girls, which we could talk about at another time. The purposes of the Sexual Violence and Victimization Committee are really to look at those dynamics that are occurring between adult men having relationships with and sexual relations with teen girls, as well as teen boys. So we have focused on addressing the link between sexual violence and victimization in teen pregnancy by doing the following things. We have required that all of the programs funded by our United Way have their program staff take annual mandated reporter training. We were pretty alarmed early on in this process when we identified that many of the youth-serving staff not only didn't know what mandated reporting was, they didn't know they were a mandated reporter. And what we know from experience and from research is that when young people disclose, whether it's a sexual or other kind of abuse, who they disclose that to and how that person reacts is critical. So this is, if you receive United Way funding in Milwaukee, your staff members have to have annual training in mandated reporting. The second thing we implemented, also system-wide, was a thorough review and approval of child protection policies for all of our agency partners that serve youth. Every partner agency, and there's over 80 of them in our particular community, has to submit their child protection policy to a group of community volunteers that are mostly representatives of sexual assault and domestic violence prevention agencies. And those volunteers, along with 2 of our lead staff on this issue, vet and approve or disapprove those policies. And you cannot receive your funding until you have a policy in place that we think is adequate and evidence to show that you are communicating that policy to all your staff. The third strategy that originated from sexual violence and victimization was the babycanwait.com website, a really comprehensive youth-focused website that has information about your legal rights, about where to access health care, about different kinds of contraception, and more. The next strategy I want to mention is Healthy Girls. For those of you in the United Way family, Healthy Girls is an initiative of our Women's Leadership Council, who has been raising money specifically for this and towards this end for over 10 years. We have in the recent years really tightened how we fund and what we do within this strategy. Our Healthy Girls programs are evidence-based approaches to reducing teen pregnancy. This year alone, we will invest $670,000 in evidence-based programs at 13 different agencies. This year alone, 3,500 Milwaukee area youth will be served by these programs, and to date, at least 10,000 youth have been reached by what we consider to be our signature program, and that's Making Proud Choices. Many of you may be familiar with Making Proud Choices. which is an evidence-based curriculum vetted by national campaign on the list of preferred curriculum that the late Dr. Kirby has approved. We have really blanketed the community in this curriculum, because not only are we funding it through Healthy Girls, it's also utilized as a supplemental curriculum in our middle schools, in our Milwaukee Public School middle school classes. And so we think to date, or our estimates are that about between 10 and 12,000 youth have completed the 16 hours of the Healthy Girls curriculum, and we're really proud of that. Another element within Healthy Girls is our Healthy Girls Youth Leadership Institute, and I should back up a minute and say this program is called Healthy Girls, and that's because initially when we formed it, it was programming specifically for girls. It also now serves boys and parents, but the name is so familiar, and those of you in marketing know how hard it is to convince you that we need to change names or change branding, that we've stuck with this name. But what I want to say is that the Healthy Girls /boys/family/community strategy that we engage also includes a Youth Leadership Institute, where our youth serving partners send either self-identified or recruit young people that they think would make strong leaders who would be able to share sexual health information with other peers. So it's a peer education model. And we take them up north to a summer camp for 5 days and 4 nights. And they spend their time talking about all sorts of issues, but primarily about how to be a good sexual health educator to your peers, which we know is a very effective model. The next strategy I want to briefly talk about is the Faith Initiative. This may seem a more unlikely bedfellow, so to speak, but what we know from both research conducted by National Campaign as well as elsewhere is that the faith community can and must play a significant role in prevention. So we've been working with places of worship to serve as settings for education and prevention activities, and since 2007, our major strategy within this initiative is implementing the Keeping It Real sexual health curriculum. So last year, between 11 and 12, 8 churches received training and have implemented the curriculum. We're about to start our 3rd cohort, which will train 4 additional churches in this. Now, this is an initiative, or a strategy rather, that has primarily focused on African American churches. That's not to say that within the Faith Initiative we think that's adequate, but we've had a more challenging time, quite frankly, reaching out to places of worship with large Latino congregations, primarily because they are Catholic for the most part, and we've had some obvious challenges there in terms of figuring out a way to navigate their faith values and their traditions while also promoting comprehensive sex education. So we have some wonderful dialogue going on. We have an entire committee that just works on Latinos and faith, and we're really feeling good about some steps that we've taken, but we have a long way to go in that community. And then perhaps the most obvious or well-known of our strategies is the public awareness and education campaign. This campaign has been going on since we launched the initiative. And what I want to say here, a number of things, but an ad campaign itself is not going to do the trick. We would never suggest that simply putting up bold or aggressive messaging about teen pregnancy is an adequate public health strategy. But what we know and what we learned from young people when we first started this work is that we have got to have messages that change, that are bold, that are creative, and that are in their face over and over and over again if they're going to get the message. So you'll see this ad, which has now actually been adopted in Chicago and is currently on display there. The point of this ad, and this is one of our first ads, was that we had become complacent as a community. We didn't seem to be that concerned anymore that 12-year-olds were pushing around baby carriages. And that is a concern. That should be a concern. We should not become complacent. We should flinch. Doesn't mean we shouldn't wrap our arms around those girls and give them every program and service they need to have a healthy family. But at the same time, we need to make a strong statement that teens need to delay parenthood. And so this was one of our first ads that did this. And we had this all over town on buses, on billboards, on posters, on the pumps at gas stations, etc. The next art that you'll see, I just wanted to give you a couple of examples of the different audiences that we reach. One of the things that young people told us very early on was that we don't want to be preached to. We don't want you to tell us that sex is bad. We do, however, think that if you tell young people how hard and expensive pregnancy and childbearing is, that might get us somewhere. So a lot of our messages have been around just that. Being a teen parent is hard. Babies cost a lot of money. Diapers are smelly. These very basic messages about why being a parent is not necessarily as glamorous a thing as you might think it is. One of our key audiences, as seen in the next ad, are parents. We spend a lot of time, and if I had more time today, I would go into our parent strategies, but just very briefly, we want to make sure that parents are empowered to be their young person's primary and first sexual health educator. During the month of October, we observe Let's Talk Month, a strategy of advocates for youth, and we blanket the community in parent-child communication toolkits that we've written in both English and Spanish that help parents understand, one, that it's more than just a one-time talk, that it's many talks over year after year after year, and that kids actually, despite the facial expressions they make or the comments they make, they really do want to learn this stuff from their parents, and we want to help parents do that. So you can see in this ad, what we're trying to say is that parents, suck it up and go in there and have some talks with your kids, because if they don't hear it from you, they may be hearing it from sources that either don't have their child's best interest at heart or certainly don't have all the information necessary. Another tactic we launched a couple years ago was the movie 2028. This was a really interesting and innovative campaign. We had flyers all around the city. We had a Facebook page dedicated to it. People were getting tickets to the preview. And then we launched the preview and we launched the trailer, and it was sort of a punk or a hoax. We had about 400 teenagers in the movie theater who watched this trailer and then learned that really it was just a public service announcement, and then we spent the rest of the time talking about pregnancy prevention, talking about what it meant to be a man, what it means to be a woman, how you can get help, how you can feel like you don't have to be forced into choices. And so it was initially met with some resistance, but it actually ended up being a really rich dialogue. And then the last tactic I want to share with you were just a series of viral videos we did with boys and men all across the community. We had volunteers go out with flip cams, and then people also used their cell phones, and they made videos talking to other boys and men about the importance of delaying parenthood. We want to make it very clear this is not simply a girl problem, and it's not simply the responsibility of girls and young women to take care of it. And these boys did an amazing job with messages. The last tactic I want to talk to you about is Milwaukee Public Schools, and I can't say enough about the importance of having your local school system part of this process. We have been so lucky to have superintendents and staff members who have acknowledged and quite frankly taken a lot of heat from other folks for saying this has to be a priority with our young people in the same way that math or English or reading have to be a priority. So our Milwaukee Public Schools have done an amazing job. And I know a few of you had some questions early on about how to get your school board involved, and I'll talk about that later if we have time, but I would also reference Advocates for Youth has a really robust section on their website about how to start conversations with school board members, how to get into a school board meeting and make your case, how to write a letter to the editor, all of those sort of grassroots tactics that really helped us in terms of turning around some of the more cynical board members. So we're very fortunate in Milwaukee. The public school systems have K through 12 sex education. I want to assure you that the kindergartners are not learning about contraception, but they are learning about what the parts of their body are called. They're learning about how to go get help if somebody has hurt them. They're learning all of those foundational things that they'll need to be healthier and happier teens and adults. Also within Milwaukee Public Schools, they have written their own curriculum, kindergarten through grade 8, and then they have two things go on at the high school level. They either implement reducing the risk or other evidence-based curriculum, or they have the high school lessons that they've also written. We have struggled a little bit with some teachers in schools who don't necessarily see this as a priority, but we have kept the dialogue going. We do follow up each semester. I meet with teachers or schools individually if there seem to be some particular barriers, and we offer the assistance of trained health educators to come in and do the classes for them. Because as you might expect, a 6th grade math teacher probably isn't all that excited about talking about contraception with her students. And those of us who have public health backgrounds, we understand that there actually is a science and a process to delivering health messaging. And so we can't just shove this in front of an English teacher and say, now teach sex ed. We really want to make sure there's enough training, which brings me to the next slide about how much we've done in terms of making sure that teachers feel empowered and strong and able to teach these messages. So for those teachers that are willing to teach sex ed within their classes, we have supported teacher training, helping them understand why this is important, demonstrating the lessons for them, letting them practice. We've also gone this year, we've made both of these things available online so that they now have, you'll see on the next slide, this says developing, but we've just finished this week a video-based training as well as an online training that we're going to pilot next year because teachers are busy, and asking them to spend a lot of extra time training in a subject that's not their primary responsibility seemed a little bit much. So we're very excited to have these more flexible opportunities for our teachers. And now that I've sort of spilled all of those things out, I know it's a lot of information to take in, let me just talk to you a little bit about how we're doing to date. So in 2008, we were so gratified to stand with the mayor and announce that the teen birth rate had fallen to a 28-year low. It was the lowest it had been in 28 years, 50 per 1,000 girls in 2007, which was the lowest rate, and over half the highest rate on record, which we were really excited about. But then the news just kept getting better and better. So in 2009, and again in 2010 and 2011, as you'll see on the next slide, the birth rates continued to fall. You'll see the decline there, which represents a 36% decrease to date, well on our way to the 46% decrease that we have boldly set our sights on for 2015. The next steps, and we have so much more to do. I think one of the reasons we've been able to see success at this time, and I'll talk a little bit if we have time about how we think this parallels the national rates and why we think there's some individual things going on here as well, but we have more work to do. And one of the wonderful things about this initiative is that we have not become complacent. We haven't let up. We are constantly thinking of new messages, new strategies, retooling what we do in a way that's going to have the most impact. And over the coming year, we've identified 3 sort of areas that we want to improve upon. And that's reaching boys and young men in a more purposeful way. So we happen to reach boys and men through making proud choices, but we've just started some very specific programming around boys and men, such as Wise Guys. We've been piloting that, as well as a couple other curriculums. We want to make sure that we continue to provide opportunity for young people to access contraception. One of the things I left out when I was mentioning Milwaukee Public Schools was the fact that they do have now a condom availability program where young people can access free condoms through their school nurse, which we think is a great step. And then thirdly, a very specific strategy around Latina and Latina youth, where we've been seeing some success, but quite frankly, we don't take any credit for it because that's not a population we've done a particularly strong job accessing. So I leave you with that, and I'm happy to spend the time answering questions that I'm sure that you have for both of us, and also to tell you that the website babycanwait.com, there's a lot more information there, as well as on the UnitedWayMilwaukee.org site, where you can get access to our 5-year summary report, which shows you what we've done in the 5 years, what the data looks like, and has a lot more detail in it.
Nicole, thank you so much for that fantastic presentation. Here is Nicole's quote and some words of wisdom that she has for all of us who are working on teen pregnancy prevention and teen birth. So making sure that we know that we owe it to our young folks to introduce strong, bold messaging, and that this is not about shame or blame. It's about really encouraging all of us to work with our youth to know that they can take control over their lives, their futures, and their reproductive health. So Nicole, thanks again for your wonderful presentation. I'm just going to take a few minutes to wrap up, and then we're going to have some time for Q&A and discussion, which generally that's my favorite part of the webinar. There have been some questions already coming in, which is great. One of the questions has been, will there be a script available of this presentation post-presentation? This webinar is going to be archived on our website, so by tomorrow afternoon or Monday morning, you should visit our website at countyhealthrankings.org to visit this presentation again. And then Nicole mentioned a few websites that you can go to as well, including United Way of Greater Milwaukee, babycanwait.com, and the Advocates for Youth website in terms of getting ideas on working with the school board. One of the things that I had to chuckle at, Nicole, when you were talking is the fact that public health loves logic models. You are so true about, you are so right about that.
We love them.
We do. If only my kids could follow a logic model, and they're only 3 and 4. But we do love them, and it does kind of illustrate what we're trying to work towards. So thanks again. A couple of things that I'd like to wrap up and say. Number one is that really making effective change really takes all of us working together, and Nicole and the United Way of Greater Milwaukee illustrated that they really do have an all-hands-on-deck approach to addressing teen pregnancy prevention in Milwaukee, and it's working. Number two, we know that data is important, so with the county health rankings information, you can learn where your county is at today, but then help set goals on where you want to be tomorrow. And that's exactly what the United Way of Greater Milwaukee Foundation has done. They have set a very aggressive goal by 2015, which is fantastic, but it's that goal that's helping motivate action. And number three, so we talked about working together, we talked about the importance of data, and I just want to put another plug in for our County Health Roadmaps Action Center. I'd encourage you to visit our website to learn more about specific steps and different actions that you can take locally to improve things. One thing that I do want to mention is that a part of our webinar, we have a number of webinars, and I just wanted to highlight an upcoming webinar with Julie Willems Van Dyke, the director of the Roadmaps program, and Jessica Curtis from Community Catalyst. That webinar is going to be talking about understanding the community benefit requirement, and that will occur on July 16th. And visit our website for more information. There are other several ways to stay connected with us. You can join us on Facebook. You can follow us on Twitter. If you liked this presentation, this webinar, give us a shout out on Twitter. Our Twitter handle is @CHRankings. And then if you want to stay informed about what's going on with the program in general, you can join our e-newsletter, and you can send an email to this email address, chr@match.wisc.edu, to join our newsletter. Again, I want to acknowledge the foundation both for their funding support and their commitment to innovation and their commitment to this overall program. We wouldn't be here without them. A lot of work from the Population Health Institute goes into this. Here are our key Rankings and Roadmaps team and our partners. And then I just want to thank you for your time on this webinar. Again, if you have questions, right now is the time to go ahead and enter those into your question box. But I like to end my webinars with a quote from one of my favorite singers, and that singer is Ben Harper. This is a song that I have on a CD for my kids and that we sing together. The song is called "I Can Change the World with My Own Two Hands." It's by Ben Harper, and I think that's just a good reminder for all of us. This is why we're here. This is why we're doing the work that we're doing. This is why you're on this webinar, so you can learn how to get more information on enhancing the work that you're already doing. So again, remembering that fact that we are working to change the world in positive ways, and that we can all do this by working together. Now, Nicole, we've got some questions, and I'm going to have the first question go to you. So what was the role of the local health department in your teen pregnancy initiative, and how did you integrate them into your work, and what are some of the specific things that they're doing to take action?
Well, they've played a huge role, and now I feel bad for not including them as their own separate strategy, but let me tell you briefly. First of all, at the helm of this initiative, I staff it, but we have 2 community leaders as co-chairs, and one of those leaders is Bevan Baker, our Commissioner of Health, who has brought such a credibility and passion to this issue. We couldn't have done it without him. We also work very closely with the folks, particularly in the maternal and child health and adolescent health departments, to make sure that our programming and our funding is aligned with what they do. one of the things that I know very clearly is I'm not the person on the ground doing this, and I need to pay attention and listen very well to those folks. And the people at the health department who have been part of this initiative to its inception have really informed our work both behind the scenes and publicly.
Great, thank you. Well, here's another quick question on coalition building. How did you go about building partnerships with the school system and implementing a comprehensive and evidence-based program?
So that's a great question, and I think it's really a key partnership. There were a couple of things at play. One is that we had a lot of meetings with the superintendent. This was not a slam dunk. We live in a state where sex education has, at least in recent years, been a pretty hot topic and very politically charged. And so initially our superintendent at the time that we started didn't want to touch this at all. But we try to rely very heavily on fact and not on emotion. We presented him with information. We made it clear that they weren't going to have to pay for any of it. We brought in tools and examples of how other schools and communities had been successful. And so I think that we just made our case somewhat without passion or prejudice, so to speak. We have a new superintendent, or newer, who came here and was immediately on board, and we couldn't have been luckier, because as you all know, when school administrators change, so do the rules. We did have a bit of a setback at the state level when our Healthy Youth Act was overturned. Previously, under the previous governor's administration, if you taught sex ed in Wisconsin, it had to be comprehensive. So you didn't have to teach it as a school system, but if you did, it couldn't be abstinence only. That has since been rescinded under the current administration, but thankfully, Milwaukee School Board and Superintendent have still elected to follow a comprehensive approach. So we lucked out a little bit, and I'd like to say we contributed by having strong relationships, and I think, again, having credibility, having the Commissioner of Health go with us on those meetings, all of those things helped.
So, thank you, Nicole. So we've got another quick question for you. So how do you go about addressing teens to teach them how to deal with the heat of the moment and birth control?
Well, isn't that a great question? We should all have the magic answer there. Here's what I think about heat of the moment, and here's how we address it through making pro-choices and elsewhere. The heat of the moment is not the time to make decisions, right? We want young people to already have a plan for themselves. We want them to have a condom in their wallet already. We want them to already be on birth control if they intend to be sexually active. We want them to have had a talk with their partner prior to the heat of the moment. Now, I was, many, many years ago, a teenager. I understand that might be easier said than done. But one of the things we really try hard to talk to teens about is the importance of taking ownership over this when you're in a rational state, not when you're in the heat of the moment, so that you already understand what choices you want to make, so that you're already prepared as well as you can be, and you don't have to fumble around in the dark, and you don't have to decide whether or not you want to go out to the store to get condoms, and you've already prepared yourself. And on the other hand, you don't have to say yet again, you've already told your partner that you're willing to go this far but not that far, and you've already had those discussions. So part of it is just communication, it's preparation, it's taking your reproductive health and your own personal sexuality seriously, and not being a passerby or a standby, so to speak, but really taking a role in protecting yourself.
Great. One of the things that you mentioned, Nicole, in your presentation was mandated reporting. I don't know if a lot of folks on this audience are familiar with mandated reporting. I'm assuming so, but if you could give a quick overview on what is mandated reporting and what the mandated reporting law is in Wisconsin and the response from your grantees regarding having that requirement. I thought that was a fabulous requirement.
Oh, great. And I'm sorry, I shouldn't have assumed 100% knowledge of that. So for mandated reporting, very briefly and simply, an adult who serves in a role where they are directly supervising or working with young people or other vulnerable populations, this also often extends, depending on your state, to persons with disabilities and to seniors, has a responsibility for paying attention to and then reporting signs of physical, sexual abuse as well as neglect. When a person in that role, so let's say there's a youth provider at agency X, suspects that a young person has been abused, either physically or sexually, that agency has to have a written policy in place. That can be that the person who sees it first has to make a call to CPS or whomever in your state is the Child Protective Services or the police, depending on the situation, or that there's a supervisor who is responsible for that. But not only do we make sure that they know that they're mandated reporters, that we also make sure that they have a mandated reporter policy that's been written at their individual agency, and that all new hires are getting exposed to that, because a policy that sits in a binder on the shelf is just that. We want to make sure that there's annual training every year. We have 2 volunteers that provide that training, or the agency can demonstrate for themselves if they have the capacity. So some of our bigger programs like Boys and Girls Clubs, they do their own training. They have staff to do that. But we have some small partners who don't have internal capacity, and so we provide that twice a year.
Okay.
But the laws vary by state to state. We have, again, 2 experts in the field of sexual violence who deliver this and who have a really strong and quite frankly a curriculum they would share with others to offer the same training.
Great, thank you. So we've got some really interesting program-specific questions for you, Nicole. Here's one from an audience member. She says, I meet with clients after they are already pregnant. Do you have any suggestions for me at this point with the client other than discussing future contraceptives and preparing after baby?
Well, I think that the 2 things you said are right on. So the first thing is that I think young women that are pregnant, we need to make sure they get all the prenatal care, all the social support, all of that stuff that they need, no question. I also think that there's sometimes an attitude or a belief of the toothpaste is already out of the tube, or I've already had a baby, why not have the second one or the third one? And I think there's some real value in talking to those young people about the benefits of delaying the next child. We know from a medical standpoint even that there's a lot of value in delaying that interconception period. But also from the point of if you're a 16-year-old first-time mom, you don't have to be a second-time mom at 17 or 18, right? There are things you can do right now to make sure that doesn't happen. And that includes, you know, some contraceptive strategies that can take place right after delivery. You know, every girl has to make the choice that's right for them. But I think you're right on the right track, which is you have to take care of the current situation first, which is ensuring that she has a healthy, successful birth outcome. But also at the same time, presenting opportunities for her to be able to take a different path after she gives birth. And to add to that really briefly, I would try whenever possible to have the fathers, unless there's a situation of violence or abuse, also participate in that conversation. I think they get left out a lot, and the dads can really play a role in both promoting a healthy birth outcome for the currently pregnant girlfriend or partner, as well as taking responsibility over delaying future births.
That's great. That's a great shout out to remember dads in all of this conversation.
Absolutely.
So what do you attribute the decrease to? Do you think it's Milwaukee riding the wave of the national decrease? Do you think that there's been a reduction in sexual activity, increase in contraceptive use? What do you think is going on specifically?
I think it's all of those things. I will say that our decrease started sort of before the national trend and that it has exceeded it in terms of the rate, but I know full well we benefit from these national trends, so I wouldn't say for a second that we're not the lucky recipients of this domino effect. That being said, based on our research with youth risk behavior data, some individual and anecdotal and qualitative stuff we've done with individual clients, we know that young people are, 1, delaying sex longer, and or 2, using contraceptive more correctly, using contraceptives more often and more correctly. So I think all of those things contribute. I also think it's important that young people often get lumped together as in this sort of, why do teens get pregnant, as though they're all sort of thinking and feeling the same things, and everybody's circumstances are very different, and we know that there are a host of factors that contribute, and that's why our intervention or our strategies have been so broad, because it's not one size fits all. And, despite what, sometimes the media makes you think, these aren't girls that are, for the most part, getting pregnant on purpose. And it's not, irresponsibility, and they're not trying to get welfare. And all of these sort of nonsense messages we get through the media, really these are individuals with unique circumstances that demand a broad array of strategies.
Great. We've got another minute or 30 seconds, and we still have a few more questions coming in. If we don't get to your question, we'll be sure to follow up via email. 2 more questions for you, Nicole, before we end. The first question is, how do you begin on this kind of a hot topic issue? How do you effectively work across political and religious lines to actually make a difference?
It's a great question, and I think it goes back a little bit to what I was talking about earlier on in terms of trying to stay as much as you can apolitical and vetted in fact. It's also about tailoring your messages. So one of the things we did very early on was I didn't make the same pitch to a church group that I did to 17-year-olds who had already had babies. I didn't take the same approach to business leaders as I did to social workers. So we had some very tailored messaging around what we think, based on research and just general understanding, would be issues that resonate. And I can tell you, for the business community, for example, which in our community trends right, I don't think that's a mystery, and also could have, quite frankly, put up some significant roadblocks in terms of, United Way in general relies very heavily on workplace giving and businesses to donate to us. We approach them very pragmatically and talk to them about the financial implications of a community that has a high teen birth rate. And that's not just about the individual cost of those babies that are being born. It's also about, if you're a business leader and you want new people to move to your community, you want a healthy, thriving community. A high teen birth rate, to your point about the county rankings earlier, is not an indicator of a healthy, thriving community. So we have to address it. We just have to respect that people are going to want to address it for different reasons.
And the last question, it's not the last question that folks have asked, but the last question for timing, is evaluation. How do you go about evaluating your program, and do you have any specific, how are you specifically measuring the awareness campaign?
Darn it, I thought I was going to escape without having to answer the dreaded awareness campaign evaluation. We do a lot of strong evaluation on the educational strategies, on making proud choices in particular, on keeping it real, on all of those curriculum-based models. We have not done a great job evaluating the media campaign. I can tell you that we understand exposure. We understand where to place things so that they're going to reach young people who might be at the greatest risk. We've done a lot of focus groups and a lot of discussions with people about their feelings and their responses to the ads, both before and after they go up. But we have not been able to, I wouldn't say we haven't been able to, we have not done a great job thoroughly evaluating the impact of the marketing materials, and it's an ongoing discussion. It's also incredibly expensive, which isn't an excuse other than to say, if given the choice between funding Making Proud Choices and doing a robocall survey of the ad campaigns, we're going to choose the programming. Again, I'm married to a researcher. I understand full well the importance of doing research, and it's an area, quite frankly, that we could improve in.
Yeah. Any lasting words of wisdom?
Well, I just appreciate everyone who's on this call, for whether they're on voluntarily or because someone asked them to. This is such a critical issue. Again, whatever brings you to the table, for me, it's a matter of social justice. It's a matter of 15-year-olds should not have their lives predetermined for them at that age. They should have every door still open. And that's not to say they can't become parents and still have those doors, but we all know that the doors become a little bit more shut or a little bit harder to unlock if you become a parent too soon. And so this is really about not about judgment. It's really about helping young people make good choices for themselves so they can become the best parents, the best adults, the best community members they can be.
Great. Thank you so much, Nicole. If you still have questions after the webinar that you think of later, feel free to shoot them to us at chr@match.wisc.edu. And if you asked a question that you haven't gotten answered, we will follow up with you directly. Thank you all again for joining us on this webinar. Nicole, you were amazing. If we could all be in a room together, we'd be giving you a standing ovation.
Oh, you're so nice. Thank you so much for having me.
Thank you. And we look forward to seeing you all on our next webinar. Take care and have a very good rest of the day. Goodbye.
Thanks so much.